In a London vaccination centre today, a steady stream of people patiently waiting for the Oxford AstraZeneca jab. Every one of them willing conscripts in the government's battle against coronavirus. But there's a problem, as we reported on Monday. Pressure on the UK's medicines regulator has been building for days amid growing concerns about a potential very rare side effect of the Oxford AstraZeneca jab. Today, the watchdog insisted the vaccine was safe for all ages. But nevertheless, government advisers took the dramatic decision to offer people under 30 a different jab.
Adults who are aged 18 to 29 years old who do not have an underlying health condition that puts them at higher risk from serious COVID-19 disease should be offered an alternative COVID-19 vaccine in preference to the AstraZeneca vaccine where such an alternative vaccine is available. The medicines regulator revealed today that the dramatic change in policy arose from an abundance of caution. It said 79 people, predominantly women, reported blood clots after having the vaccine in the UK. 19 of those died, and 3 of the fatalities were under 30. Several being vaccinated today admitted to some nervousness.
This morning I heard they stopped for the children. And, and this thrombosis coming up, he's a little bit worried.
She's happy to go ahead with it, but she was a bit stressed, because of the symptoms, what she might come down with afterwards. But yeah, she's happy to have it done still.
The two, that is the one I wanted. Whether it being the name Oxford made you feel, easier.
Senior sources involved in the decision told me restricting use of the Oxford jab would delay by at least a fortnight the plan to offer all UK adults a jab by the end of July. Politicians will also be worried about the potential impact on the release from lockdown.
To answer your question absolutely directly, I don't think that anything I have seen leads me to suppose that we will have to change the roadmap or deviate from the roadmap in any way.
England's Deputy Chief Medical Officer also insisted any change to the vaccine rollout would be negligible.
That, of course, is contingent upon getting the supplies that we expect to get of the alternative vaccines. This is a course correction, there's no question about that, but it is, in a sense, in medicine, quite normal for physicians to alter their preferences for how patients are treated over time.
In Wales today, a new weapon in the UK's armoury, the Moderna vaccine, the third to be deployed after the Pfizer and AstraZeneca jabs. 3 more are expected to be available later this year. But with 100 million doses of the AstraZeneca vaccine on order, Britain is very reliant on it. Several countries on the continent have already restricted use of the vaccine. One government advisor told this programme that Britain should have followed suit weeks ago. Europe's regulator said today that clotting was a very rare side effect, but gender and age weren't clear risk factors. And in the context of the thousands of deaths a day across the EU, the benefits outweighed the risks. For older age groups, the danger of death from COVID far outweighs the risk of fatal side effects from the vaccine. Health experts are keen to maintain public confidence as the threat of a third wave of COVID looms and to keep the risks in proportion. The UK regulator revealed today that around 1 person developed a potentially fatal blood clot for every 250,000 people vaccinated. The risk of being hit by lightning in the UK is 1 in 1.2 million. The number of people killed on the UK's roads in 2019 was 1,752. That's more than 1 in every 37,000 people. But the risk of dying after contracting COVID is far higher. The Oxford jab remains a linchpin of the global fight back against COVID, nowhere more so than in the developing world. One senior source involved in today's decision said any move to restrict its use there could end up leading to tens of thousands of needless deaths. Well, joining me now is Professor Anthony Harnden, who's Deputy Chair of the Joint Committee on Vaccination and Immunisation. Professor, we know that in this country, 19 deaths could potentially have been avoided. Should you have restricted this AstraZeneca rollout earlier?
No, I mean, it's quite clear that we needed to investigate this extremely rare adverse event very, very carefully. I mean, it's strongly possibly linked to the Oxford AstraZeneca vaccine. We're not certain yet. Both the EMA, that's the European regulator, and the MHRA, that's our regulator in the UK, have deemed this vaccine safe and effective in all age groups. However, we on JCVI look very carefully at other factors, which include the risk and the benefits of the vaccine. And for the vast majority of the people that we're vaccinated at the moment, and that includes those age 18 and above with underlying health illnesses, the benefits of the vaccine far outweigh the risks.
Well, I wanted to ask you, yeah, go ahead.
There is this very small group of the well under 30s that have been immunized at the moment, and they are predominantly those household contacts of immunosuppressed, those carers, and some health and social care workers that haven't been immunized yet. And because the benefits risk ratio wasn't as clear in this age group, we wanted to issue prompt advice that those people should receive an alternative vaccine wherever possible.
But I wanted to ask you about the cutoff point, because I wonder what you'd say to a 30-year-old female relative of yours, for example. Would you advise that they still get the AstraZeneca vaccine?
Well, what I would advise, Kathy, is that they wait till their turn. If they're well and they're 30, they won't be immunised for quite a number of weeks yet. And as this is an evolving situation where we're looking at this data as it comes in and trying to understand this very rare side effect in more detail, we will issue prompt and immediate advice as soon as we characterise it more.
So the age at which
alternative... At the moment,
I'm just wondering, the age at which the alternative vaccines are on offer, that could change. I mean, the government charts, for example, don't distinguish between gender. So I just wonder if it's proven that women are more susceptible to this blood clotting side effect than men, would the risks of the jab potentially outweigh the risk of getting COVID for women aged 30 to 39?
Well, we don't know that yet. That's the problem. And this is why the regulator are poring over these cases in detail every single day. And as any new cases come in, of course, when you start looking for something, you do get a flood of cases which are identified. So I fully expect that to settle down over the next few weeks and it will become clear. But at the moment, there doesn't seem to be any strong sex link for this particular adverse effect within the UK. But there does seem to be a bit of an age gradient, which is why we've issued this precautionary advice.
Do you think the European Medicines Agency has got it wrong by saying continue rolling this out to the under 30s?
No, I think they've got it absolutely right, and they are closely aligned with our regulator as well, who have said that we can use this vaccine in all age groups. I think what you have to remember is that on JCVI, we often do this with vaccines. So, for instance, with influenza vaccine, we offer a different vaccine for the over 65s and the under 65s, and yet both vaccines are licensed for all age groups. So it really is both the regulator doing their job very effectively and us on JCVI doing our job incredibly effectively, which should give the public absolute confidence in our decision making for their benefit. Given that the data is changing the whole time and you're analysing that, and it could be that you end up having to say, well, people over the age of 30 shouldn't get this jab, they should get another one instead. Can politicians be absolutely confident about hitting that target date to offer a jab to all UK adults by the end of July? Well, as you know, Kathy, I'm not an expert in supply, but I do understand that there is sufficient vaccines of alternative types to offer everybody under the age of 30 who is well a different vaccine and still reach our targets more or less. There may be a slippage of a week or two after the end of July. That I don't know, but clearly we're on target at the moment. We've got a very, very successful and effective vaccination program. We've saved more than 6,000 lives. That's up to the end of February and more now. That I'm absolutely sure. And what we don't want to risk is infection rates rising as we all want to come out of lockdown and a large third wave because of people not wanting to take up the vaccine. The AstraZeneca vaccine is effective, it's safe, and the benefits far outweigh the risks in the majority of the population.
Just very briefly, is it possible that you could have the same issues with the Johnson & Johnson vaccine, which is delivered in a similar way to the Oxford AstraZeneca one in terms of blood clotting?
Well, that's a very interesting question, Kathy, and one that we don't know. But of course, you're absolutely right. And the Johnson & Johnson vaccine is a viral vector platform vaccine, a similar type to the Oxford AstraZeneca vaccine. We don't know whether this is specifically related to the particular type of platform that the Oxford AstraZeneca vaccine is delivered in, or whether it is actually more of a generic problem with that vaccine type. And that is something that we will be looking at with all the worldwide data very, very carefully.
Professor Anthony Harnden, thanks very much for joining us.
Thank you.
Well, Channel 4 News was the first to reveal on Monday that the MHRA was considering changing its guidance on the AstraZeneca vaccine. But again tonight, no one from the government would come on the programme, and neither were we able to ask a question at this afternoon's press conference. The Department of Health and Social Care last granted an interview to this programme 70 days ago.